Welcome to Expanding Access, a podcast by Behavioral Health Tech, where we explore the cutting edge of mental health, substance use, and autism and IDD care. Each episode features insightful conversations with industry leaders who are driving real change through technology and innovation. Whether you're a provider, payer, or just passionate about expanding access to behavioral health care, you won't want to miss these stories. Let's dive in. Hello, everyone. I'm Solomay Tibabu, your host of the Expanding Access podcast, where we discuss all things expanding access to behavioral health support. And today we have got a really special guest. I can't wait to share more about the Clubhouse model and all that Josh and his team are doing to support so many individuals across the country. Thank you so much for joining us, Josh. Why don't we get started with a little bit about who you are and your role and what is Fountain House?
Sure. My name is Josh Seidman. I am the Chief External Impact Officer at Fountain House. Been here about 4.5 years. And Fountain House is a clubhouse. And in fact, it pioneered the Clubhouse model, which is a psychosocial rehabilitation model that really centers on people's lived experience. It is run in partnership with people with lived experience who are members. They're not clients or patients. They are voluntary members of this community. And it was actually started by people with serious mental illness back in 1948. People were actually coming out of state institutions where it was an entirely medical model at that time. And they said, this model isn't working for us. We need something that addresses our psychosocial needs, something that addresses social drivers of health. And they actually started meeting on the steps of the New York Public Library, and they called themselves WANA, We Are Not Alone. And from that came ultimately this clubhouse. And there was a New York benefactor that gave them some space on 47th Street in Hell's Kitchen in New York City. And that was the birth of Fountain House. But it has now expanded. And now Fountain House has 4 clubhouses, but there are actually now 380 clubhouses in 33 countries around the world, serving 100,000 people, all people with serious mental illness. And again, all people who are working in partnership. Happy to talk more about that. You asked a little bit about myself. So I'm actually in Washington, D.C. most of the time. I'm up at Fountain House 1 week a month. That's in New York. But I've been kind of trapped in Washington, D.C. for 35 years now, where I've done a variety of things in research and policy. I would say there are sort of 4 reasons I ended up at Fountain House. So the first one was that I came to believe that we really were addressing too much, or focusing too much on the clinical side. And after 30 plus years of focus on how can we improve healthcare, I felt like I wasn't doing enough to improve health. And again, Fountain House kind of figured out decades ago that we need to be addressing those social drivers of health and psychosocial needs. And the second thing was that even though, I have a PhD in health services research for 25 years now, I've done a lot of work in human-centered design. I essentially said, if I want to try to improve care delivery, I need to think about innovation from the perspective of people with lived experience. And so started doing a lot of work in following people outside in their daily lives, following people throughout their clinical experience, observing clinicians and patients in clinics and hospitals. And through all that, realized that care delivery innovation can only work if we are starting from what are the needs of people with lived experience. And once again, Fountain House figured that out many, many years ago. The third reason was that, my own personal experiences with family members who have suffered from serious mental illness. And I just personally decided that was something that I wanted to try to figure out if there's anything possible in my own skill set that I could use to try to figure out how to fix our broken mental health system. And then the final reason that I came to Fountain House was, I mentioned I've been trapped in Washington, D.C. for 35 years. And I feel like in Washington, we kind of have this feeling like, if something hasn't been done, it can't be done. And in reality, that's often not the case. It can't be done until it gets done. But what I think happens is that in much of healthcare, and certainly inside the Beltway, we suffer from a lack of imagination. And that's something that nobody at Fountain House ever suffers from. And so it's really been refreshing and a real wonderful experience to be part of this community that really strives to improve the lives of people with serious mental illness throughout the country.
That is just so incredible, Josh. And I personally had an opportunity to go tour and experience Fountain House in New York myself. And just the sense of community was palpable. It's like, I wish I could even articulate the inclusivity that I saw with my own eyes, that this stuff really works. But could you talk a little bit about, what data has been collected on this model historically? Because
Yeah.
this is proven. It makes a difference.
Yeah, absolutely. So we know that we have higher rates of employment, more successful housing for people who are in clubhouses. So we know that in our population, about 35 to 40% of people who come to Fountain House have some history of homelessness. We, in addition, and Fountain House, by the way, clubhouses are non-residential models, but Fountain House itself also operates 400 units of housing. And housing is an important part of how we support our community. We have higher educational attainment. We also have a big impact on people's everyday lived experience. So we track things around loneliness and quality of life, and we know that we're having a big impact on that. So for example, we know that 73% of the people who come to Fountain House enter the clubhouse with high levels of loneliness. This is according to the UCLA 3-item loneliness scale, a validated survey instrument. And we know that at time of follow-up, about 12 to 18 months later, 58% of them have reduced levels of loneliness. So that's a pretty big impact on something that makes a huge difference in their lives. We know that economic and social isolation is a really important piece of why people come to clubhouses, and just in general, people with serious mental illness. Of course, it's a big issue for everyone. I mean, we know from the Surgeon General's public advisory on the epidemic of loneliness from a couple of years ago that this is something that has huge public health impacts, both mental health, physical health. Surgeon General talked about how it's comparable to smoking 15 cigarettes a day. So that's, one thing. So, and we see similar impacts on quality of life. And then there's the whole cost side of the equation. So we know from a NYU study that compared to a comparable high-risk SMI population, we reduce Medicaid costs by 21%. We've also done economic modeling because we want to understand the economic impact beyond just health costs. So when you take into account not just costs of mental health and physical health, but also disability, criminal justice, and productivity or lost wages, we know that clubhouses save society more than $11,000 per member per year. So it's something that has a huge impact on people's lives.
That's remarkable. I guess continuing on this theme of how do you measure clubhouse performance, I'd love to hear a little bit about how community members are involved in developing the measures that are used for these kinds of assessments.
Yeah, that's absolutely critical. And we sort of asked ourselves the same thing a few years ago when we sat down with members, which is how we do everything. So everything at Fountain House is a blended leadership model, and that includes how we do research. So for people who aren't familiar, there's something called community-based participatory action research. And it's essentially that our members are not subjects of research, they are partners in research. So we train them in research methods. They get engaged in sometimes conducting focus groups, coding interviews. Some of them do quantitative analysis, and they help us to set a research agenda. So when we embarked on a project, which is actually just being released now, just this week, it's called Measures That Matter. It was funded by 4 foundations. And this project was essentially trying to answer the question, kind of like what you were just asking, right? Is answer the question of what really matters to people with lived experience. So historically in behavioral health, we kind of measure what's easy to measure rather than measuring what really matters. And the idea here was we actually starting with people in our own community. We conducted 20 working groups. We also had, from that, we did 4 focus groups with people both who are members of clubhouses and people with serious mental illness who are not members of clubhouses. We fielded a survey with nearly 100 responses. So we collecting information from over 100 people with lived experience. We came up with a framework for what really matters. And, happy to talk more about that. It started again from our own experience a few years back of just sitting down with members and saying what really matters to you.
Oh, so many could draw from that experience and adopt these amazing best practices. Really exciting to hear. I'd love to also, on that same thread, hear a little bit about why you decided to create a data sharing network amongst all of these clubhouses now and what's its purpose.
Yeah. So Fountain House, I mentioned there are 4 clubhouses that we operate ourselves. So there's our original flagship in Hell's Kitchen. About 11, 12 years ago, we opened one in the South Bronx, which is a very underserved area. And then New York City has decided to make a big investment at clubhouses throughout the city. It wants to double the number of people served by clubhouses. And as part of that new contract, we decided to launch another one in Central Harlem, which just opened earlier this year. We also were asked by the LA County Department of Mental Health to come into LA. There's a lot of need to address serious mental illness and its intersection with homelessness in California. And the Department of Mental Health said, hey, we really know that clubhouses are part of the solution. There are no clubhouses in LA. And so they asked us to come in. And just over a year ago, we launched one in Hollywood, which is now a very robust community, over 100 active members. And Mayor Bass was just there a couple of weeks ago. And we've done that. But beyond that, as I said, there are clubhouses all over the country and all over the world. We decided we wanted to try to think about what can we do in the broader community of clubhouses so that the research we're doing isn't just about Fountain House, that it's about clubhouses across the country. We started off this process about 4 years ago, but there are now 21 clubhouses across 11 states that are now participating in something called Fountain House United. And we decided from the beginning about 3 years ago, pretty much, we started developing a lot of training in data and research methods. Keep in mind, a lot of these organizations are really small community-based organizations and don't have a lot of history with data collection, reporting, research, and things of that nature. Although they know how important their solution is, they know that they provide a lot of value to the communities they serve. And so they really were anxious to figure out how to do better in documenting that. So a lot of work went into building a lot of capacity among these clubhouses. And we've now built a platform for data sharing. And this data sharing network, which it's the Fountain House United Research Network, or FHURN, FHURN. FHURN is not only going to be sharing data, it's ultimately going to be a very robust learning health system. And the idea is really that if you have clubhouses across the country collecting a common set of data elements, sharing that data, they can use that data for quality improvement, they can use that data for collaborative research, and they can use that data for evidence generation and really furthering the understanding of how to best serve people with serious mental illness to help them to thrive and recover.
And once again, Fountain House is really pioneering this space. That's just incredible. And what a great resource to so many other clubhouses. Would you say, is the data sharing network designed primarily for performance improvement or maybe accountability of the clubhouses, or a little bit of everything?
A combination. So absolutely, it's something that can be used as for performance improvement, because it is something that as people are using the same data instruments and they're able to compare against one another, and allows them to see where are there areas for improvement, what are other clubhouses doing, where also it's not just sharing the data, it's also then sharing best practices. So if people are trying to figure out, well, oh gosh, you're really having a great impact on the employment levels of your members, how are you doing that? You can sort of begin to have those conversations. So it's a very dynamic process of how that data will be used to do that. It is also, though, something that we absolutely believe can be used for accountability. We absolutely believe that we need to be moving towards more value-based payment systems. And it's critically important that value in those value-based payment systems be judged by things that really matter to the people being served by them. And so it's in that context that we need to make sure that people are performing on that. In New York City, we actually now are being required, starting about a year ago, there was a new clubhouse contract put into place in New York City, which is requiring clubhouses to report on data around some of these social outcomes, employment, education, things of that nature, hospitalization, ER rates, emergency room rates, and then a series of member-reported outcomes, so quality of life, and loneliness, and self-efficacy. These are all things that the city is requiring to be reported, and they haven't announced exactly how that data will be used. My guess is that, the idea is that you begin by requiring reporting, and once you develop a data baseline, you can then use that for purposes of performance assessment and accountability.
Incredible. So much opportunity there. And for those in the audience who might be learning about the Clubhouse model for the first time, I'm just wondering, how would one go about finding, navigating, and just becoming a part of any one of these in their community?
Yeah. So just in general, in terms of a lot of the resources that I mentioned, fountainhouse.org is a great resource in terms of the research that I was mentioning and things like that. Some of our white papers and other research is available. If you want to find a clubhouse, the best way to do that is through the Clubhouse International website. So Clubhouse International is an organization that has now been independent. It spun off from Fountain House over 30 years ago, is an independent accrediting organization. So it accredits clubhouses according to a set of 37 standards. And these 37 standards are always evolving, which is again a process between staff and members of clubhouses contribute to the evolution of these accreditation standards. And clubhouses that go through that process, every 3 years to become and then to maintain their accreditation. Anyway, on the Clubhouse International website, there's a directory, and that directory can be searched by state or country or wherever people are, so they can find out where the nearest clubhouse is to them.
Wonderful. Thank you so much for sharing all of this great information for our audience. Now, I'd like to ask you just one last question, which is, how can our audience of payers, policymakers, funders, innovators support Fountain House and the Clubhouse movement in general?
Well, I think we absolutely believe that there needs to be greater investment in clubhouses. We see that, I mentioned, in New York City, in California, when New York State has actually recently just invested in clubhouses in the budget this year. There's money to start up. Probably, they're telling us about 8 new clubhouses in New York State. In California, I mentioned what the county did inviting us in, but they're also planning to convert 6 existing drop-in centers into clubhouses over the next couple of years. California also did a Medicaid state plan amendment to make Clubhouse reimbursable through Medicaid for the first time in California. And they did that in conjunction with a large behavioral health Medicaid waiver that was approved at the end of 2024. And that waiver essentially said, hey, there are 5 or 6 evidence-based practices that we know work for people with serious mental illness, and we're going to encourage counties in California to take up clubhouses as part of that solution. So we see that there. We also see it in other states, in states like Ohio and Michigan and Indiana. There has been a growth of clubhouses, again, where states have said, we realize this is both a cost-effective solution and it is a solution that really helps people in their day-to-day lives. And so it's something that has been highly supported in blue states and red states and purple states. So we see that across the country. I would also say that I alluded to value-based payment models. We know that that is an important direction that we need to go. We're looking forward to seeing how CMMI, the Center for Medicare and Medicaid Innovation's new IBH model goes. So that's an innovation behavioral health model, where again, they have said that we want to look at patient-reported outcome measures for people with moderate to severe mental illness to understand what is the impact on people's lives. And then that comes back to that Measures That Matter project. And I'll just quickly give you a flavor for what's in that report, which is just about to become publicly available. But essentially, people with lived experience said, the first thing we have to do is sort of establish a foundation. So there are these foundational measures or readiness measures, enablement measures. So those are things like, have you helped connect me to needed resources around housing and food and things of that nature? And then the second thing is people said, well, yeah, one of my problems is that, I don't really trust the healthcare system. So measures of trust are important. And we know that trust is a really big impediment to people with serious mental illness, not just for their mental health, but also for their physical health needs. And we know that people with serious mental illness live on average about 20 years less than the general population. And that's a combination of mental health and physical health issues. And then the third thing they said in terms of these foundational elements is self-confidence. In the measurement world, we call that self-efficacy or agency, but essentially measures like that. And so those are the three constructs around those enablement measures: connection to needed resources, trust, and self-efficacy. The second thing was then once you have done that sort of foundational work, then you can really get to some of the outcomes that matter most in terms of positive life changes or patient-reported outcome measures. And these are things like quality of life, loneliness or social connection, and then achievement of one's personal goals. And then the final category was service use. Essentially, can we shift care upstream? Can we move from crisis care to preventive care? And we've seen this in our own environment where I mentioned that NYU study that found that Medicaid costs reducing 21% for the high-risk SMI population. There's actually a 35 to 45% reduction in hospitalizations and ER visits. And that's somewhat offset because you see more primary care, you see more outpatient mental health, and you see more use of pharmacy because of better medication adherence. And I think that all, again, relates back to the beginning, the trust piece, right? I mean, if people develop a stronger trust in the healthcare system, they're much more likely to engage with it.
So many great points. And I hope our audience has captured all of these many initiatives that really need our support, because this is a model that needs to continue to scale and grow and continue to make such a great difference. So thank you, Josh, for sharing that. And of course, as always, taking the time to share your expertise with the BHT audience.
My pleasure. It's been fun.
Thanks for tuning in to Expanding Access. We hope you're feeling inspired by today's discussion. If you've enjoyed the episode, subscribe and share it with your network. For more content and opportunities to get involved in transforming care, visit behavioralhealthtech.com. Until next time, let's keep pushing boundaries and expanding access together.